Hello, my name is Stevie Barbosa and I will be delivering a presentation today on mental health and coping strategies. My presentation will be in 4 parts and it will be for a duration of 10 minutes. The first part will be about sources of psychological stress. The second part will be the effects of psychological stress. The third will be about coping strategies used to reduce stress. And the fourth will be how effective those coping strategies are. Psychological stress is both an emotional and physiological response to an external trigger. When an individual experiences psychological stress, biochemical changes occur within the body as a response to a perceived threat. Primarily, stress hormones are released via the glands. This includes adrenaline, cortisol, noradrenaline, although noradrenaline is released via the nerves. These biochemicals can have long-term negative effects. The sources of physiological stress can include traumatic events such as bereavements, witnessing an assault or being assaulted, or being impacted by a major incident that has long-term harmful effects. Everyday stress can build up over time and it tends to be low level but persistent, making it potentially harmful. It is not dissimilar from acute stress in the same sense that it goes away once the problem's resolved. Financial worries, not being able to make ends meet, falling behind with bills, being contacted by debtors, unexpected stress that can abruptly increase stress levels. This can include redundancy, facing eviction, divorce, or being diagnosed with an illness. Personal problems, relationships, money worries, housing issues. Acute stress or circumstantial stress that tends to be short-term and goes away once the problem is resolved. Chronic stress is prolonged periods of stress that can cause harm if left untreated. Social factors, economic instability, racism, injustice, unfairness, prejudice, discrimination, or violence in society. Internal factors like negative self-talk, pessimism, perception, and attitude. Stress can be caused by a variety of reasons. It's important to consider that stress affects individuals differently depending on the person. There is some positive and negative stress. Positive stress is a beneficial type of stress, which stems from positive challenges such as starting a new career or entering a competition. It acts as a fuel by providing energy, focus, and a sense of achievement, unlike negative stress, which causes distress and negative symptoms like overwhelm, fear, and anxiety. This type of stress usually occurs when the individual experiences major life changes that are unpleasant and causes harmful effects on the individual's mental health and ability to cope and manage. Stress can be both short-term and long-term, and it can have short-term and long-term effects, which has psychological and physiological effects on an individual. Routine stress or everyday stress can have harmful effects on physical health and can lead to a higher risk of developing it can lead to a higher risk of developing diseases including heart disease, stroke, weight gain, diabetes, or it can make worse medical conditions like asthma or eczema. Lifestyle may be negatively affected. Lack of motivation could lead to a person not exercising or eating a balanced diet. A disturbed sleep pattern, a lack of self-care, not attending to personal hygiene, reduced self-esteem, anxiety and depression, low self-worth, low libido, headaches, chest pain, mood swings, altered perspectives, extreme attitudes, self-medicating or developing a dependence on drugs and alcohol. Stress may be a reaction to a major traumatic event. Post-traumatic stress disorder, or PTSD, can impact somebody weeks, months, or even years after it's happened. PTSD can have a huge impact on an individual's life, affecting everyday tasks, how they have relationships with other people. They may experience anxiety, depression, low mood, low motivation, emotional breakdowns, changes in behavior, inability to cope, overreactions to situations. They may be withdrawn, not trusting of others, have recurring nightmares, flashbacks, self-isolation and avoid situations, suicidal ideation, thoughts that they're better off dead, increased risk of coming to severe harm, accidental death, or actively planning to take their own life. It's important that they are treated by a medical professional. Coping strategies are when an individual develops tools and ways of learning how to manage and cope with stress. Different types of coping strategies include mindfulness techniques like accepting what's out of their control, doing activities that are enjoyable to give them a sense of calm, journaling, writing down a plan of action, and giving them a sense of control. Exercise, moving the body to release the happy endorphins, forming healthy habits to improve the mood and overall health. They could do meditation for relaxing and clearing the mind and gaining clarity. Deep breathing techniques to slow down the heart rate and calm the nervous system. They could accept emotional support by sharing problems with a friend or talking to another person, maybe calling a helpline like Mind or the Samaritans. Getting professional help, so speaking to the GP, asking for a referral for counselling, talking therapy, or seeing a psychiatrist. Engaging in cognitive behavioural therapy to challenge the perspective and learn how to problem solve. How effective are coping strategies? It is important to consider that effective coping strategies are many-sided. We are all individual, therefore the most effective coping strategies will be on an individual basis. They'll include factors like how resilient the individual is, if the stress is still persisting as a problem, and how willing they are to build resilience and utilize strategies that will reduce stress. An individually tailored plan alongside a support system to give a sense of purpose, increase self-worth, and allow a fresh perspective on life will be most effective. To conclude, the strategies that we've discussed are effective, some more than, some less than, depending on the individual and how willing they are to put in the work. Thank you for listening to my presentation.